with the accounts that come out, it's how the program runs. Like I said, if there's something in particular, if somebody wants to ask me exactly what's in a particular account number, I can get back to you. People are more than welcome to ask if there's a particular vendor. I can take a look at what account numbers that is paid out of, but I wouldn't know unless you guys gave me specific check numbers and kinda went that way, just because of the way that comes out of the system.
Okay, and, a week or two ago, you asked me about the statute on, the check register. And it does say, to have what the check is for, a column for that too. And I think our old check registers used to have that. So if you could add that, like.
I'll have to talk to our, software company. Like I said, this is a report that runs out of the software.
Okay, but like I said, this particular item is something, required by the statute, and the statute, you know, says what you have here, who it's made to, the dollar amount and all that, but it also requires some idea of what it was for.
Well, most of those software packages calculate two options. One is summary, one is detailed. And so it's probably just simply a matter of running your detailed
It could be.
check
I'll have to
register,
take-
and that'll give you your additional 1 to 2 columns, which will probably rotate the page in terms of making
It very well
readable
could
and-
be, yep.
Yeah, so it's basically a matter of running the detailed one versus the summarized.
Right, well, the only reason I'm mentioning it is because you had asked me about that statute, you said you wanted to make sure you're doing it right, so.
Yep.
I'm pointing that out. And I also asked why the employee payments are no longer on the check register when they used to be. And I just got an answer that basically they're not required to be, but they should be.
The individual names, from my understanding, are not required to be itemized out, but if the board would like, I can put in my report or somewhere on here, I can tell everybody what the total of the payroll is.
It's not total, I mean, the old check registers, before July, they actually had the check and who it was written to, you know, their 2-week pay or whatever. And it was itemized along with all the other ones.
And that could have been the way that the program was set up, I don't know. Because we had a different software program, I just know when we switched software programs, this is the check register that came out that has been being presented since July of '23. So,
What are you hoping to get with individual weekly payments?
It's transparency, you know, the
well,
public.
like I said, I can go through and tell you guys how much we spend on payroll every check register.
The public that pays for this, the idea is they have a right to see, just like the checks, you know, who are the checks going to, how much are they? And that's how it's been for, you know, 10, 15 years, and I just wonder why it's changed now. And if we're trying to achieve, you know, transparency to the public, that's just one aspect of it. And sure, 90% of the time, people don't care. But if there's 1 or 2 people out there, you do it for them, because they're the taxpayer.
Well, again, it might be a function of software, because this is the new software that we're using, so maybe it knows, you program someone, maybe understands, employee payroll is not necessarily a claim, whereas a check for gasoline, credit card expenses might be a claim.
Right?
So it's gonna just require some further investigation.
I'm sure it's just simply a matter of digging around in your reports that you have available, that you probably haven't had a reason to look into further, but they're there. I'm
Yeah,
sure they are.
And right now, the way that it's kind of put in is we, as the village, send a lump sum of money to the bank.
Yeah,
and then the bank distributes it.
yeah.
So on because I've did some talking to other municipalities as well, just to try to figure out how they've been handling it, cause everybody seems to be switching softwares. And a lot of them said they just inform the lump sum amount of money to the board and they're okay with that. If the board would like more detail, I can go back and I can start digging through the reports to see what the software provides.
Yeah, I'm sure they're there. It's just a matter of you haven't had a reason to look them up in that particular way, and I guess it sounds like now you have a reason, so.
Okay, well, I just, trying to get that straightened out a little bit.
So let us know what you find out.
Right.
Okay.
And now, if someone wants to know, if someone asks you for wage information, that's still available, right?
If somebody asks me, I take it as an open records request and send it to the village clerk.
Okay, because when I asked for these to be put back on the check register, apparently, yeah, you did treat it as a public information request, and that was denied. So
That I don't know, I had to send it over to the village clerk.
Okay, so,
That was denied per reference from our village attorney.
well, that would be helpful if you would, mention that and mention the reason for it, because just a simple denial.
He's asking for, wants to see payroll checks or something, right, Lisa, is that where he's, I go right now?
I believe it was the list of names on the payrolls. Correct.
Well,
That was
I mean,
good.
all you
It's
gotta do-
itemized.
all you have to do is look back, before last July at the check register, and you'll see.
Yeah, but
That was
that's a
done
different
incorrectly.
software, that's where I'm trying to tell you, it's like,
Okay.
gotta do some more.
Okay.
Just have to run the query typically, it's not rocket science.
Anything else?
No, that's not.
Alright, moving on to item number 4, new business item H, discussion and action, future ambulance service for village.
I'll have Lisa bring up a more point, but first off, I wanna hand out some information. This was posted on Facebook. After a meeting with our current contract service provider, and some comments added to it. This is in reference to specific hotspots in Kronenwetter. If anybody would like a copy and to see the comments that are on it, I'll leave it up here.
Have some back?
That's just.
This was after a meeting, this was after a meeting with Riverside, correct? And a comment and a post that was put on Facebook.
No, I'm the one that posted it.
Yep, I'm aware. This portrays what they feel about our residents and certain areas in our village, okay? So let's go ahead and start from the beginning of this. PowerPoint, please.
Yep, that's the
Okay.
beginning.
The village of Kronenwetter is 52 square miles. It is the largest village in the state of Wisconsin by land. January 1st of 2023, our population was 8539. Comprised of commercial, residential, and agricultural. In 2006, an addition added to the existing municipal building to add police department, expand fire department with bays to add future ambulance service. See the ambulance in front of the bay there? 2006, this was the future plan of Kronenwetter. That is the entire picture of this current municipal center building. This is our fire department bay, currently today. As you can see, the far left, there is room for 2 ambulances in that fire department. And all the other equipment we currently have. Okay, so history of EMS service in Kronenwetter, and all of this is in the proposal as well, just spelled it out a little differently. Emergency medical responders respond to all locations within Kronenwetter, respond direct to home or scene upon dispatch with EMS equipment to initiate care including advanced airways, oxygen, naloxone, AED. In 2023, we initiated on-call weekends guaranteeing at minimum one EMR on all medical calls, with medical equipment including an AED and a Lucas device, which is an automated CPR device. This was initially funded by grant funds, as well as was the pickup truck that we currently use for those on-call weekends. That was purchased with grant funds. We had Schofield and Mosinee split EMT basic. We had Mosinee, EMT basic and AEMT, or at that point it was called ID Tech. Schofield, EMT basic. Rib Mountain, EMT basic, intermediate technician and paramedic. Safer, when Rib Mountain moved to the Safer Fire District, our contract rolled with it, they were paramedic level service. Riverside Fire District, in 2022, they were an AEMT flex to medic. So all of their revenue from 2022 is at the AEMT level, and they are unable to charge anything higher than an AEMT service, okay? In 2023, August of 2023, they became paramedic. Wisconsin EMS service levels. This spells out the different service levels in EMS in the state of Wisconsin. EMS servicing in Marathon County. Mosinee is EMT basic, flex to medic. Stratford, EMT basic, flex to medic. Edgar, EMT basic. Athens, EMT basic. Hatley, EMT basic. Riverside, which is Schofield Rothschild, paramedic. Only since August 4th of 2023. Safer, paramedic. City of Wausau, paramedic. Vernonwood, EMT basic. Central Fire, EMT basic. Spencer Fire, AEMT, and Wittenberg, AEMT. The majority of Marathon County is serviced at an AEMT or less service, okay? For those services with levels below paramedic, there is an average of 7% of calls requiring more advanced level of care. With AEMT service levels, that average is much lower since AEMTs are also a level of ALS service. What is flex staffing? A service can flex up to a higher level than the service's base level if they have personnel that could be licensed higher and is available on the call. For an example, if they're licensed with the state of Wisconsin to practice AEMT, but have paramedics or RNs on their service, they can flex to paramedic, meaning that when those staff members are available, they could utilize them to practice those skills. However, they cannot bill their patients for the higher level of service. So the proposal, creation of ambulance service within the Kronenwetter Fire Department as an entity of this village of Kronenwetter. So I'll correct Guy Friedel, it is not a fire district. We are a fire department, which is an entity of this village. So everything in it would be controlled by you.
The proposal was by the Kronenwetter Fire District.
No, it wasn't, it was fire department.
Okay, whatever.
Provide ambulance services at the advanced emergency medical technician level to all residents, non-residents with a need for medical assistance within the village of Kronenwetter. For calls requiring more advanced level of care, utilization of paramedic intercept services, for example, major trauma, active seizures, some cardiac emergencies, thus keeping the majority of ambulance calls at a reduced expense to the patient. Continued utilization of first responders. In addition to the ambulance response, at minimum one EMS personnel would continue to respond directly to scene upon dispatch. This is 24/7, 365 days of the year, coverage utilizing a combination of daytime staffing and on-call using historical data to determine complete staffing model. Daytime staff would be utilized for initial and immediate fire response, when historically personnel coverage is lower for fire calls during those times. So we would also be able to get our fire trucks out the door faster as well. With the location of the fire station, on-call staff could and would be utilizing areas within the fire station for sleeping quarters. The station is already currently equipped with locker rooms, showers, kitchen area, and basic essentials and lounge areas. The target start date of the proposed ambulance service would be January 1st of 26. Some of the benefits of a municipal ambulance service is community coverage. It ensures comprehensive coverage for emergency medical needs within this community. Local control. Municipality would have direct control over the service, allowing them to tailor it to our local needs. Decisions on staffing, equipment, and protocols are made by local authorities, including patient-level billing fees. It's an integrated service. Municipal service can collaborate closely with other public safety agencies, such as the fire department and our police department, to create a seamless emergency response system. Community investment. Municipal service invests in local jobs, training, and infrastructure. It contributes to the overall well-being of this community.
Teresa, can you put that mic closer to you?
Emergency preparedness. Having a dedicated municipal ambulance service enhances disaster preparedness and response. It ensures adequate resources during emergencies. It's also revenue generating, billing for services allowing generation of revenue to support the ambulance service with any additional revenue going towards the general fund. There are some additional benefits. I won't read through them, but the biggest one is supporting our police department. Knowing our officers well is a huge benefit of having our own ambulance service here. When they get pitched out on the call and they need our help, we know them, they know us. They know what kind of care we can give and compassion that we will show up with. Funding opportunities. There are continued efforts on behalf of the government entities to improve funding opportunities. There are now numerous grant opportunities to assist services in many of these areas. One I didn't include on here, but the Village of Kronenwetter is receiving 90% more in shared revenue to be used for police, fire, EMS, and our public works. So the governments are recognizing the need for additional funding there. There's also the FAP grant, the AFG, FEMA grants, SAFER grants, and other additional funding. The FAP grant from the state of Wisconsin has an annual distribution for ambulance service vehicles or vehicle equipment. In addition, any transporting agency is welcome to apply. That amount used to be around 10,000. It was announced this year that it will be between 30 and 40,000 per entity that applies. That's an increase in funding over and above what I have in my proposed budget. Our current contract with Riverside Fire District is a 3-year contract signed June 2022, and it runs from January 1st of 23 through 12/31 of 25. The initial cost was $592 per capita based on the latest census. For 2023, that cost is $6.04 per capita. $50 for patient care report, which is the number of times they are dispatched regardless of patient contact or transport. But this village pays them. Riverside receives all revenue from patient level billing. Village of Kronenwetter has no control over their staffing or patient level fees. So in 22, we had 427 calls for emergency medical services. Of those, 332 were transported, 34 were canceled prior to arrival, or once they arrived on scene. 51 were no transports at all, and 7 were standby for Kronenwetter fire calls, and 3 calls were answered by SAFER. In 23, we had 408. Again, 315 were actually transported, 39 canceled prior to them arriving, 36 were no transports or refused evaluations, 5 standbys for Kronenwetter fire calls, 8 calls, they did not give us any information on their report. 3 calls were answered by SAFER, 1 answered by Wausau Fire, and 1 no ambulance was required. It was for Kronenwetter EMS to assist the police department. This page has the Riverside 2024 budget showing revenues based on an AEMT level service. And if that is not accurate, then that would be grounds for fraud, because in 2022, they were providing an AEMT level service. So the revenue they received for 2022 was $214,608.54 based on Kronenwetter calls alone.
Were we not on SAFER then, right?
Say that again?
We had SAFER then, right?
We did not. Riverside was our ambulance contract in 2022.
Okay.
So in 2022, when we signed the contract, this was the patient level billing fees. And what these fees are what you are going to get charged if you call an ambulance, okay? So ALS 1 and ALS 2 are varied by what skills they use at the time that they give you patient care, okay? BLS is your basic, ALS 1 is they might start an IV, and ALS 2 is IV pushing a couple of drugs and doing cardiac monitoring. They split them out by resident fees and non-resident fees. I can't answer you what Kronenwetter residents are being charged, because I do not know if we are considered residents or if we are considered non-residents. I don't know that. Non-residents?
Yep.
Okay, so then the non-resident is a fee to the village of Kronenwetter. Flip the screen. You need that to be a little larger. I don't know if you can. Go to.
Yeah, just open the presentation.
There you go.
I tried and it won't
So
show the
2020,
presentation.
in 2023, without consulting